good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. As I'm sure most of you know, COVID-19 cases have continued to rise both in Ohio and nationally in recent months. When we last spoke, Ohio was seeing about 3,000 cases a week. By last week, that number had risen to more than 8,000. Now, for perspective, it's important to note that the case levels have not approached those even of our past winter, let alone the remarkable numbers from several years ago. Ohio had 18,883 cases reported last month. Compare that to the 41,344 cases we had in January of this year and the more than 500,000 cases that we had in January of 2022. Fortunately, the variants that are currently dominant, LP1, KP2, and KP3, are all within the same family of Omicron variants that we saw earlier this summer. This continues a trend of variants that are evolving to become more transmissible, but are not producing a greater severity of disease. The fact that the virus is more transmissible, though, really should be something that we take seriously. Even if you have only mild symptoms of COVID, it certainly can disrupt your life, as hopefully you'll be conscious of staying away from others while you're sick. Nevertheless, we still see an average of more than 200 hospitalized patients with COVID-19 and, sadly, an average of 17 deaths each week. These numbers are a stark reminder that if you spread the virus to a family member or friend who's in a high-risk category, such as someone over 65 or those who have impaired immunity, a COVID-19 infection could be a very serious threat to their health. The good news is that we have a very safe and very effective vaccine to prevent this illness and lessen its impact. You've heard me say this many times, but the fact is, the best way to protect yourself and others against COVID-19 is to make sure that you are vaccinated. Last week, the U.S. Food and Drug Administration approved an updated COVID-19 vaccine for the 2024-2025 season. The vaccine is formulated with more recent variants in mind, especially the JN1 and KP2 lineages. These lineages are either currently circulating or very similar to some of the other variants that we are seeing circulate, affording those who get the updated vaccination enhanced protection. The CDC recommends that anyone ages 6 months or older who has been previously vaccinated receive 1 dose of the new 2024-2025 vaccine. At this time, the CDC is not recommending that those over 65 get a second dose unless they are immunocompromised. Some locations now have the updated vaccine available, and we expect availability to increase as we move into September. We advise you to check with an individual location before going to get the vaccine. Also, the vaccines.gov locator tool will be updated soon. The rising number of COVID cases also illustrates the value of having COVID tests on hand at home. Now, these tests are sold in stores and pharmacies and remain free for those enrolled in the Medicaid program. Also, the federal government recently announced that it will once again provide free COVID tests. Starting in late September, Americans will be able to order up to 4 tests per household through covidtest.gov. Tests are an important tool, not just so you can protect others, but also in determining whether you might benefit from treatment. Our own governor, Mike DeWine, announced last week that he had tested positive for COVID and was treated with Paxlovid, an antiviral medication. I'm happy to report that the governor is back to his normal very full schedule this week. Paxlovid has proven to be safe and effective in reducing hospitalizations. It is important, particularly for those who are in high-risk categories. But it's important to note that it requires a prescription and is most effective if taken promptly after symptoms first appear, which is within 5 to 7 days. Along with COVID-19, we also need to be thinking about some other respiratory viruses. By this time next month, we'll start into our annual respiratory virus season, which means it will also be important to look at getting your annual flu shot. Those are reformulated every year, and the new formulation should be available in September as well. If you are going in for a COVID shot, consider a twofer and get both a flu and a COVID shot at the same time. Along the same lines as COVID and flu, another very important vaccination to consider right now is the vaccine for RSV. The CDC recommends an RSV vaccine for anyone age 75 and over, or for those 60 to 74 if they're at increased risk because of certain underlying medical conditions. This is not an annual vaccine. So if you've received an RSV vaccine, you do not need a new one. If you have not received it, though, now is the perfect time to go and get one. There are also RSV vaccines for pregnant women and a shot for infants. Now, if you're pregnant, I encourage you to talk to your provider about this vaccine. It's called Abrysvo, and it can protect your newborn child from RSV, a virus that hospitalizes far too many infants every year. The CDC says that women who will be 32 to 36 weeks pregnant anytime between September and January should get this vaccine. Now, if their mother did not get an RSV vaccine during pregnancy, the CDC recommends a different RSV shot, nirsevimab, for all infants younger than 8 months of age born during the RSV season, that's October through March, or who might be entering their first RSV season. These shots are very important. Too many young children end up hospitalized and very sick at the start of their lives due to RSV. Vaccines can help prevent that. And the point that I will make today about vaccines is, as much as we talk about respiratory viruses and recommended childhood vaccinations, all adults should also make sure they're up to date with their recommended vaccines. For example, the DTaP vaccine protects us against tetanus, which is an environmental disease that can cause severe illness, as well as protecting us from becoming a spreader of pertussis, or whooping cough, which can be very serious if it is caught by young children. Now, before we welcome in our guests today, we all need to remember that COVID-19 can leave behind a constellation of lasting symptoms and problems that are now known as long COVID. And long COVID can be debilitating. There's good news, though. In July, the New England Journal of Medicine published a study that showed that rates of long COVID were markedly lower among people who had been vaccinated. We already know that vaccination helps lower the chances of contracting a severe case of COVID. Now we know that it helps protect against long COVID as well.